Hello students, we will discuss a condition, a swelling, again which is not uncommon. It may be kept in the exam as a short case or may be kept as oxy or sometimes viva MCQs it may be asked. So just see what this condition is. See that in the elbow there is a swelling. Olecranon process comes like this and this is the skin, swelling is here. Naturally it is Olecranon bursa, otherwise called as student's bursa or student's elbow, minor's elbow. So it is anatomical subcutaneous bursa located between olecranon process and skin. So in this area, olecranon process and skin, this is the area. Olecranon process of the ulna, the middle aspect comes and stays here. So this area it is located. So this is a typical olecranon bursa. It is non-tender, smooth, soft, fluctuant, skin is free, mobile in two directions. Pressure test may be positive or two direction perfusion can be said, but non-translucent. Become tender if it is infected. Occasionally it may get calcified. So in such situation become smooth and hard inconsistency as such. Sometimes it is bilateral. This opposite side has to be examined. Regional lymph node has to be examined because you may have differential diagnosis, or if it is infected, axillary lymph nodes may get examined. So you have to keep wider range of differential diagnosis. It may be lipoma, it may be sebaceous cyst, it may be neurofibroma. Each has got its own clinical features to consider which is the right thing, which is the most probable clinical diagnosis. So, but you have to keep in mind all these different swellings as a differential diagnosis and rule out one by one. That is the important point. So, examination of swelling properly is very, very important. So, I already told all these features, often bilateral, everything. So, it is typical olecranon bursa, student's elbow or minor's elbow. In the exam, maybe kept a short note also. So, you have to picturize this one very clearly. But exam swelling in detail has to be done. That's the most important thing. So, X-ray of the part should be taken, and treatment is excision under GA or local anesthesia. And each excision is quite easier because usually in the subcutaneous plane. So, technically it is very easy to remove this olecranon bursa as such. So, you can go through my clinical method surgery for exam of swelling and my manual of surgery detail about olecranon bursa. Technical aspect of swelling, excision, it is there in operative surgery book 2 volume. And how to do suturing in tissue approximation with that class shows details about that. My digital lectures through JP gives a very clear idea about all topics, video lectures by me, which will cover UG, CBME syllabus, everything, including specialties, clinicals, and operative surgery, X-rays, instrument specimens, and it is useful for PGs also for basic idea. So students, I hope you understood this olecranon bursa very well. Thank you very much.